Frank VASSALLO, CEO of Kemptville District Hospital. I'm here to introduce the second video in our series about our campaign that we call The Patient Experience Starts Here. We created this campaign to help each of us appreciate that everyone who works, volunteers, or provides services here has a significant impact on the experience that our patients and families have at the hospital. With this campaign, we want to ensure that everyone who comes through our doors experiences patient and family-centered care. This second video celebrates unique examples of times when our staff, physicians, and volunteers have gone above and beyond for patients, demonstrating their dedication to patient and family-centered care. Thanks for watching.
I help facilitate getting all our ducks in a row to pass our accreditation survey. In preparation for that, my office was located in the emergency department area. And this one day, I will never forget it, but this little toddler, he was probably about 1.5 years, he was so sick, but they don't like to stand still, and he was going up and down the hall and just not really quite a happy camper. So my coworker decided, oh, we've got our Curious George car. Curious George is our mascot for accreditation. And she says, give me your car. So I said, sure. So we gave the little guy our Curious George car, and he was up and down the halls with it, and he had a smile on his face. At least 1 year later, I went to have my car serviced locally, and the attendant noticed my button, and she said, oh, she started to tell me the story about her little guy, you know, at the hospital, and I was like, oh, that was me, that was us. And she said, to this day, he still has his Curious George car, and he plays with it all the time, and she will never forget what great care and attention he got here at Kemptville.
This year, there's been quite a bit of freezing rain, and some days we come to work, though the snowplow staff are doing their best to keep the parking lot clear and safe to walk on, still it can be a little bit dicey at times. And one time there was this little old lady that was coming through the emergency area, and I noticed that a family member had just dropped her off, and you could tell that she was struggling to be able to get into the emergency room. So I was almost inside. It was a cold day, but I decided I would turn around and go and extend my arm and have her hold on to me while we crossed over the icy spots to be able to help her into the emergency area. It wasn't a big gesture, but she really appreciated me taking the time to help her out to keep her safe, and I was happy to do so.
These are palliative care gowns that were made by Sylvia, one of our volunteers at the hospital. I provided her a pattern of one of our original gowns, and she went and chose fabrics to help people brighten their day when they're in palliative care. The idea came from Beth Laporte, one of the nurses here at the hospital. Most of our patient gowns are just like a shade of blue, and we wanted something with a bit of a pattern, and we contacted her through a mutual friend.
I had a lot of pleasure anyways shopping for the material. That might have taken a morning, and as far as sewing is, I sort of fit them in between other sewings that I do. And you might say, I don't know, rough guess, 3 hours to 4 hours per gown. Maybe a little more. Time doesn't mean too much when you're retired anymore.
We've already had them in use for a patient. Beth called me, and I brought up a gown for the patient, and they used them, and the family were very happy with the colors choices, and they just brightened their day.
I had previously talked to this one patient and had booked her into one of our clinic days on a Thursday. And she, I guess a few days later, called me back to explain that her son was having surgery here on Wednesday, that could she possibly come to have her appointments, you know, the two in one, and the day before. And she had explained to me at the time that she was coming from a far away, over 2-hour drive. And immediately I thought that, you know, this was not an unreasonable request, that I was going to do everything in my power to make this happen, you know, for this patient. So immediately I went to my supervisor, explained the situation, you know, and we involved all the appropriate departments, lab, x-ray, booking, and so we made it happen. I'm so happy that I was a part of the team to be able to make this happen for her.
My job is essentially to ensure the safety of patients as they embark on their journey through surgery. We take care of patients from their initial contact through their entire surgery through to their point of discharge. Our initial contact with patients usually requires us to try and allay their fears that they may have about the upcoming surgery. I'm proud to say that we get multiple compliments with regards to the care we provide. I'll read you a letter that was sent by a patient that really encapsulates the fact that multiple members of the surgical and anesthetic team are required for the patient to have a pleasant and safe experience at this hospital. Please accept my congratulations and expression of appreciation to all the staff at KDH with whom I came in contact during my outpatient hernia surgery: Shannon, my contact nurse for the clear and friendly admission instructions; Dana, the nurse who helped me get ready for surgery; Dr. Kirby, my anesthetist, who outlined my options. He answered all my questions and helped me make the right choice, a spinal injection which worked perfectly and exactly as he described. Dr. Davison has performed a couple of surgeries for me before, and he's a terrific surgeon with a terrific sense of humor that set me at ease in the operating room. Nurse Marilyn, she is truly professional with a sense of humor whom I placed my trust in immediately. Nurse Linda rounded out our OR team that you should be most proud of. Nurse Pat in the recovery room was excellent as well. Sincerely, again with appreciation.
Little children would come in, and sometimes the mom and dads come in with the little ones, and they come in and they have nothing with them because they just came running into the hospital. They're upset, everything is upside down, and so I make these to give to them. They're free, they're completely watchable, and they're stuffed with quilt batting. I have all little odds and ends, doesn't take much yarn, and I had so much leftover yarn, I thought I gotta make something with them. So I started with these, and then I give them to the little ones. If it's all right with mom and dad, I ask them first, and I've never had anybody say no. I'm working on across the 200 mark on making these dolls. Each one takes about 3 hours and a bit to make. There was a little girl in last week on Thursday, and she was upset. And I came to her with 2 selection of dolls and said, which one would you like? And she said, oh, I would like to have, and then she picked which one she wanted. I said, well, you have to give it a name. And she said to me, well, I don't know. What's your name? So I told her mine. I said, well, my name is Johanna. Well, that's what I'm going to call my doll. I haven't seen one yet left behind, so they all get taken home.
I'm really happy to be here to share with the community the wonderful experience that myself and my family had when my husband passed away at the Kemptville Hospital, because it was a beautiful textbook palliative ending to a wonderful life. You know, there would be a gentle knock on the door. Can we just come in and empty the garbage? Would it be all right? Or do you think Mr. Arnold would like a little dish of ice cream? Or just those personal things that really had an impact on me. The nurses and the doctors do a wonderful job as well, but I think we forget the other people that are part of that team that sometimes don't realize what an important role they play. The nights that we sat up with him, they were always there with a blanket and, you know, a cup of tea, or, you know, where the nourishment room is if you need anything. And when you're in that place, I can't explain how important those little things are. I think for my children, seeing their dad die in a loving environment with no pain, wow, it had a real impact on them. They're at an age where a lot of their peers' parents are passing away, and they both said to me, wow, Dad had a really good passing. And he did. The parking lady, I've got a week's parking pass, probably a couple of days before Buck died. So after he passed away, when I came in to hand it in, she came out of her little office and gave me a hug. And she will never know how much she needed hugs at that time. The people that have been employed here, they must put them through a stringent interview because they're all very caring people. And the staff not only took great care of Buck, but they also looked after me and our adult children. It was just it's hard to express a sad, sad time being an okay time. And I have nothing but wonderful memories of that horrible, horrible evening.